Pro Group Management, workers' comp that works for you.
Welcome to Nevada Newsmakers. This is Orrin Johnson filling in for Sam Shad. Joining us today is Assemblyman David Orentlicher, representing Assembly District 20. Next on an all-new Nevada Newsmakers.
Love and luck are in the air at Carson Valley Inn. $1,000 winners guaranteed every drawing night. Up to $7,500 every Saturday. And $15,000 in grand prize giveaways Friday, March 31st. It's the Love and Luck giveaways at the Carson Valley Inn.
Big R in Sparks is located on Bering Boulevard next to Smith's and across from Reed High School. It's a 50,000 square foot hardware store and a whole lot more. It's huge, with clothing, power equipment, tools, and of course, hardware. Big R is located on Bering Boulevard in Sparks next to Smith's and opposite Reed High School. Big R, hardware, and a whole lot more.
What do you count on? You count on your power every day. At NV Energy, we've always powered what's important to you, but we're not looking at the past. We're focused on the future. While our standards are high, our rates will remain low. And our commitment to renewables isn't just meeting standards, but leading the way. Because you can count on more than just your power. You can count on the company who brings it to you. That's our promise. You can count on it.
When in Carson City, Nevada Newsmakers records in the conference room at the Bank Saloon. Coverage of the 2023 legislative session is brought to you by Liberty Dental Plan, making members shine one smile at a time. Pro Group Management, workers' comp that works for you. The Regional Transportation Commission of Washoe County, your RTC, our community. NV Energy, proudly serving Nevada, providing electricity to 2.4 million electric customers. And by Nevada Builders Alliance, building a better Nevada.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
Welcome back to Nevada Newsmakers. This is Orrin Johnson filling in for Sam Shad. With us today is Assemblyman David Orentlicher, who represents Assembly District 20. Welcome, and thanks for joining us today.
My pleasure. Thanks for having me.
So I want to get right to it. You have sponsored a lot of bills and co-sponsored a lot of bills, and there's a lot of interesting stuff to talk about. And by way of background, because I think it's important, you are both a doctor and a lawyer. Is that correct?
That's correct.
So, tell us just a little bit about, did you privately practice medicine or law? Tell us a little bit about that.
Sure. Good question. So from college, I went to med school and did a first year of a residency in internal medicine and practiced for about a year. And as I was going through medical school and my training, postgraduate training, I especially interested in the ethical and legal issues that came up with my patients. So I decided to go to law school after my 2 years of practice. And then from law school, I then practiced a couple years before starting to combine my expertise in medicine and law and do a lot of health ethics and policy work. First with the American Medical Association, I directed the ethics program there, the AMA, issues an ethics code for physicians. So I worked on end-of-life issues, beginning of life, organ transplantation, access to care. And then from there, I went into teaching. So first at Indiana University, both at the law school and medical school, teaching health law courses. And also with my legal background, I taught constitutional law courses and served during that period, about 15 years ago, in the Indiana legislature for 6 years. And then about six and a half years ago, I moved here to University of Nevada, Las Vegas to teach at the law school. The health law program there was looking to expand. We knew it's a small world, those of us who were in the health law world. So they encouraged me to apply, and I liked a lot of things about coming to Southern Nevada. So I moved here in 2017 and have been in the legislature since 2020.
All right. Well, so let's put some of that to work today. I'm curious. So you have a couple of bills to increase access, I think, to medical services, which is obviously that's a major problem in Nevada. And I'm talking about AB 198, which reduces some of the barriers to telehealth operations. Tell us just a little bit about that.
Yeah, so as we've seen in the past few years, and especially during the COVID epidemic, having access to healthcare through telehealth is critical for a lot of people. And during COVID, when you couldn't leave your home or go to a public place. But we also saw, even in normal times, if you're in a rural setting where there aren't enough healthcare providers, if you don't have good transportation to get to the doctor's office, for some people, it's just more comfortable to be in their home than to come to a doctor's office with a lot of other people. So we've seen there's a lot of value to telehealth in any setting. But there are barriers, and we want to make sure we can facilitate. So let's say, for example, you have a relationship with your doctor here in Nevada, and you're on vacation, and you're traveling in California or Florida. This act will allow your doctor here to treat you while you're on vacation.
So let me ask you this. Why was that ever not allowed in the first place?
Well, that's a good question. One of the realities that maybe needs to be updated, but it's true with healthcare professionals like doctors and nurses, and also for lawyers, is we do the licensing state by state. So you are licensed as a doctor to practice in whatever, say Nevada, you get a license and you can practice in Nevada and you can treat patients in Nevada, but it doesn't allow you to practice in other states.
So, but along with, so I want to get into the other side of the coin with a couple other bills that you have, which is, I saw AB 85, which does some, looks like price fixing for certain medical services. So if one of the problems is that we're short of doctors, how does limiting the money that doctors can make for their services, or at least micromanaging it, doesn't that push doctors out of the profession? I know a lot of doctors don't want to take Medicaid anymore for these reasons. I feel like you're taking one step forward and two steps back with that. That's what I saw when I saw a bill. Tell me why I'm wrong if I am.
Well, I will. Thank you for asking. So Assembly Bill 85, which you asked about, is about regulating the prices. And this is for hospitals. It's not for doctors. It's only for hospitals and other facilities where, like an outpatient surgical facility or a freestanding emergency department. And the reason why I'm doing that is, as you may know, and as well documented, our healthcare spending is way out of line with every other country, and it's growing exponentially, so that healthcare is becoming unaffordable, has become unaffordable for millions of Americans. We spend the most on healthcare, but we still don't cover everybody. We don't cover as many people as other countries, which are our economic peers. And so healthcare is an important benefit and service, and we should spend more than most countries because we are a richer country, but we spend too much and we don't get, the bang for our buck. So why is healthcare so expensive here? Because hospitals charge more. Why do hospitals charge more? Because they have too much market power. It's not
or because there's a lot of administrative stuff from regulations that they have to go cover. And so when we see, and price fixing increases regulation, doesn't it? It increases costs.
Well, actually, this is going to good question. And this is going to reduce their administrative burden, because right now, hospitals have to undergo negotiations over prices with multiple insurers, and they have multiple billing clerks. I think it was Duke University Hospital has more billing clerks than they do doctors. And by having the state come in, and this is what every other country does to keep healthcare costs under control, to have the state say, here's a reasonable rate. You eliminate all these negotiations with different insurers, and you don't need nearly as many billing clerks. And so actually this will reduce the administrative burden and bring down costs.
All right.
Basically what it's doing.
So we're gonna have to pause right there, but I want to come back to reducing costs and some other controversies when we come back.
Win some Leprechaun loot during the $75,000 all-cash Go Green giveaways. More than 150 winners in all. Find your pot of gold with $15,000 in weekly cash giveaways guaranteed. And $25,000 in grand prize giveaways, including a $15,000 cash top prize. It's a good time to win at Tamarack Casino.
Early in the morning or throughout the night, professional truck drivers are on the job, serving you, safely moving freight that's crucial to our economy. From the oldest industries to our newest innovators. From the exotic to the everyday, trucks are everywhere, moving everything. Never afraid to embrace a future that makes Nevada and our nation stronger. Trucking moves America forward.
The Do It Right guys at Nevada Heating have one mission. Your furnace breaks down today, we fix it today. Why freeze for days while your furnace is down when Nevada Heating can get the job done today and you can get warm again? For nearly 50 years, locally owned Nevada Heating has been getting the job done right. Call today at 323-5585 and we'll fix it today. That's 323-5585 or online at nevadaheating.com.
It's a good time to win at Tamarack Casino.
Located in the heart of Carson City, the Bank Saloon is a historic watering hole with a modern feel. With a variety of classic cocktails featuring Nevada spirits, space for private events, conferences, and an incredible atmosphere, the Bank Saloon offers a great location to work and play. Come visit us. Located at the corner of 5th and Carson, we'll save you a drink.
This is Nevada Newsmakers.
And welcome back to Nevada Newsmakers. This is Orrin Johnson, filling in for Sam Shad. If you're just joining us, with me today is Assemblyman David Orentlicher, who's representing Assembly District 20 out of Clark County. So one of the biggest and most controversial bills that I think you're sponsoring is probably SB 239, or at least co-sponsor of, which is the, you mentioned earlier, end-of-life care. Assisted suicide is what this whole topic is called, at least when I was younger. So tell us, what does SB 239 do?
Yeah, that's a good point. And to put it in context, since the 1970s, we've had an important discussion and debate and legal reform over how do we deal with patients at the end of life, people who have a terminal illness. There's no way now to cure them, and it's just a matter of making sure they have a comfortable dying process and they don't suffer unnecessarily. So starting in the 1970s, we recognized at some point patients can say, I don't want to continue on a ventilator or with dialysis or chemotherapy because it's causing me too much suffering and it's not making me better. So we established, starting in the 1970s, the right to refuse life-sustaining treatment. There are some patients who are dying just as terminally ill, suffering just as much, who aren't dependent on a ventilator to breathe or dialysis for their kidneys. And so to relieve their suffering, the idea came, let's give them the option to get a prescription from their physician for a dose of medication that will end their life and end their suffering. So it can be called medical aid in dying is the term that it's used, and it's been legalized in a number of countries, including Canada, and about 10 states in the United States. And now we're bringing it forth here.
So I want to talk about Canada, because one of the things that the libertarian in me says, that's fine. It's your life. You should be able to go out on your own terms. But as our healthcare system is increasingly bureaucratized, is increasingly run by, or at least controlled by, the government in terms of what you're reimbursed for and what you're not. We just spoke in the last segment about reducing costs. Already in Canada, there's been some controversial cases where people who weren't interested or didn't bring it up felt that the government-funded system was pushing assisted suicide on them to save the government money. Is that not the ultimate path that this can go down if there's sort of a culture that encourages this sort of thing? That's the chilling thing to me at the end stages.
So that's an important point. We don't want the right to die to become a duty to die, which could happen. And so there are a few things that are reassuring. One is Oregon has allowed this for over 20 years. So we have a good track record. And what we have seen is that it's been used appropriately for the reasons we've talked about, people who are terminally ill, suffering, and we haven't seen it misused. And one of the important reasons is that there are strict guidelines that you have to be terminally ill. That is, you have to be diagnosed with a disease or illness or injury that will, in all probability, end your life within 6 months. That you have to be competent, you have the capacity to make your own decisions, that you don't have dementia that makes you unable to think thoughtfully about this kind of a decision, and you have to administer the medication yourself. The physician prescribes it, but you have to take it yourself. And those safeguards have been very important, because when you look at from other countries, say, or in the United States, sometimes it's done unlawfully. The problem cases are the cases of patients who aren't terminally ill. And so we've been very careful in this country to have careful safeguards. And the other thing to keep in mind too is the same concerns.
But beyond just legislative stuff or anything else like that, is there some sort of pushback opportunity or anything else like that? I'm a veteran. I get my health care through the VA. I'm not super trusting of the federal government these days, or haven't been for years. I worry about that stuff. And so what's to protect me or my family or that sort of thing if folks in the government decide they want to save some money and do go a little bit further 5 years from now?
Yeah, well, so the other area, the sort of practice that is reassuring is we've had the right to refuse life-sustaining treatment since the 1970s. And for patients who are dependent on a ventilator to keep them alive or dialysis, these are patients who could live for many years, and their treatment is very expensive, and you're going to spend far more keeping patients alive on life-sustaining treatment for a decade than you are somebody who's terminally ill for 6 months or less. And the important point is we've had this for 50 years, and we haven't seen the kinds of problems because doctors are very careful, right? They have this ethical obligation and moral imperative to keep their patients alive. And if anything, they err on the side of keeping people alive.
I'm not sure I'm totally reassured, but we're going to have to take a break right now, and I want to get into the other side of your professional practice. We'll be right back.
Win some Leprechaun loot during the $75,000 all-cash Go Green giveaways. More than 150 winners in all. Find your pot of gold with $15,000 in weekly cash giveaways guaranteed. And $25,000 in grand prize giveaways, including a $15,000 cash top prize. It's a good time to win at Tamarack Casino.
Imagine a magical garden that feeds Carson City's hungry and homeless, teaches our high school students agriculture, creates hanging floral displays to beautify downtown, and yet charges nothing. It's not magic. It's the Greenhouse Project. It's real, it's growing, and it needs your help. Go online to carsоncitygreenhouse.org so together we can grow it forward.
Pro Group Management is the place where companies can find workers' comp solutions that are designed to meet their specific business requirements. As regulations evolve, Pro Group takes a proactive approach to clear the path to make sure your business stays ahead of the curve. Knowing your workers' comp program is optimized, you can focus on other important matters related to your growing business. Pro Group Management, workers' comp that works for you.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
It's a good time to win at Tamarack Casino.
This is Nevada Newsmakers.
And welcome back to Nevada Newsmakers. This is Orrin Johnson filling in for Sam Shad. If you're just joining us, with me today is Assemblyman David Orentlicher, who represents Assembly District 20. So, Assemblyman, you said at the beginning you're both a doctor and a lawyer, and now I want you to take your doctor hat off. Let's put the lawyer hat on a little bit. You have a couple of bills with respect to some criminal justice stuff. One is AB 193, which specifically prohibits children who are being interrogated police from being lied to by the police when they're in custody. So tell us a little bit about that. What brought that up?
Yeah, the concern here is avoiding the problem of false confessions. We know that children, for a variety of reasons, their judgment often isn't mature, and so they, think very short term rather than long term. And the short term, how can I get home, as opposed to the long term, I may be in prison. They want to please authority figures. So especially when you've got a police officer, your sort of inclination is to trust them, and they do everything they can to make it seem like they're on your side. And so what we've seen is a lot of false confessions by minors, and this bill is to limit the possibility of that happening.
So you talk about some techniques, building rapport, that sort of thing. You see that in every interrogation, whether it's an adult or a child. To play devil's advocate, I think police would say that's being able to tell a white lie or that sort of thing in order to try to get to the truth is an important part of their investigations. If lying to a suspect it risks a false confession, why limit it to children? Why not apply this to everybody?
Well, that's an important question, right? These kinds of techniques undoubtedly will elicit false confessions. So we have to, draw the balance, because we don't want to miss the opportunity to elicit a truthful confession. And with minors, the risks of false confessions increases more, and the possibility of truthful confessions drops. So as you're trying to draw the balance, this bill is designed to get a better balance, because our balance is off right now, and we're getting too many false confessions.
Okay. And then you have a BDR, I don't know if it's an actual bill yet, where you want to reduce fines for folks who've been deemed indigent. And I got a copy of that BDR, I looked at it. It seems fairly complex. It requires judges to go through a fairly complex process to determine whether or not somebody is indigent. Is that a cost that's worth the benefit to when judges already have discretion right now to reduce fines and misdemeanors?
Yeah, that's a good point. And so there are a few things here. One is, this is a process they're used to doing to decide whether you need a court-appointed lawyer. And as you say, they already have the discretion, so the process is still there. So we're taking a process that already exists and just making sure we apply it in a consistent, fair way, because right now it depends on your judge whether you get the relief that you're entitled to, and we want to make sure it's across the board. But the other thing about this, we see too.
Isn't it always important to keep some discretions with the judge? I've seen a lot of injustice where the legislature, with all the best of intentions, has tried to kind of box judges in and take away that discretion because of some past injustice that happened and actually wind up creating more injustices. Isn't it better in the long run to allow the judges, even when some of them will abuse it, to keep their discretion intact?
Well, you're right. So there's a balance here. Sometimes there are cases where mandatory minimum sentences was an area where judges didn't have enough discretion. So this is an area we've got a lot of studies and documentation to indicate that when you employ a program like this, you get overall better benefits. So for example, the likelihood of an indigent offender paying off their fine goes from maybe 30% to 60%. And that's an important benefit for this kind of a reform.
Excellent. No, I appreciate that. Unfortunately, that's all the time we have for today. I talk about this stuff for hours. Thank you so much for joining us. We really, really appreciate it.
Oh, my pleasure. And happy to come back and talk some more.
Excellent. That's all the time we have for today. We'll be right back.
Save money and take transit. Did you know you can ride the bus all day for less than what it would cost you for a gallon of gas? Plan your trip now by going to rtcwashoe.com.
Hi, I'm Renee Summerhour, digital news anchor here at 7 at 7. Watch our streaming nonstop newscast immediately with your mobile phone. 7 at 7 is the new way for you to get every bit of local news you need in just 7 minutes. Breaking news, local neighborhood news, weather, and sports are just a click away. Reporters bring you all of what's happening in the Valley. From Roku, Amazon Fire, Apple TV, YouTube, and more. Get every bit of local news you need from the RJ and LVRJ.com.
Southwest Specialties has been making the homes and businesses of Nevada beautiful for more than 20 years. Their experienced designers and craftsmen create the walkways, backyards, water features, and a variety of outdoor cooking areas that add curb appeal and value to your investment. Call today or visit them at their website and see how they can make your outdoor spaces special. Southwest Specialties, creative, distinctive, beautiful.
Modern boutique Ahern Hotel and Event Center sits at the heart of the Las Vegas Strip. 2 floors of meeting and event space are ideal for groups and conventions. Stay in one of 200 luxurious rooms and suites. Brand your event throughout the property. Flexible event spaces make for easy planning and personalization. Take over the entire hotel with a full buyout option.
Snorkel personnel lifts are engineered beyond the industry norm to an uncommon level of safety and durability, and with an eye towards sustainability. They're also designed to be simple to operate and maintain. Snorkel, always at the cutting edge of progress.
That's all the time we have for today. Thank you so much for joining us. This has been Orrin Johnson filling in for Sam Shad. You can join us 24/7 at NevadaNewsmakers.com. We'll see you next time.